Hi everyone. Wanted to talk a little bit more about vitamin D today. The question for the day is vitamin D an essential or inessential nutrient? Okay, as we know, vitamin D is just that. It's classified as a vitamin, at least we refer to it as a vitamin. And of course, it's considered a fat-soluble vitamin. Vitamin A, D, E, and K, again, are all fat-soluble. But the question is it essential or inessential? That's the first question we're going to discuss. Again, when we're talking about essential nutrients or essential vitamins, basically all this refers to is anything that we can't manufacture in the body, and therefore we have to get from the diet. We have to get them in the diet because they're important, and we're not going to get them any other way. Okay, inessential would therefore be, I guess you could say, not as important in the sense that we manufacture them in the body. Vitamin K we manufacture with some of the bacteria in our gut. Some of the B vitamins do the same thing. We have amino acids that we can manufacture as well. But then some vitamins, of course, and of course amino acids, to use another example, are essential. So we need to get them in the diet. So the question is, what about vitamin D? So many of you know that we can produce vitamin D in the body if we get UV sunlight. Okay, so the way it works, just to clarify, is that we'd go outside. We'd obviously have to have skin exposed. I don't have a lot of skin exposed other than my head, right, face, that sort of thing, but my arms and legs right now are completely unexposed. But let's say I went up there and my skin was exposed and we had good strong UV. I am in Florida where we always pretty much have, 12 months out of the year, good strong UV light from the sun. And the UV would have to be able to penetrate my skin. So again, if my skin's exposed and I'm outside, here in Florida, the UV is definitely going to have that opportunity to penetrate my skin. Obviously, when would it not be able to penetrate my skin? Like I said, if my skin is covered with clothing. There is a little bit of UV, yes, that passes through the clothing, but not a lot. Very, very little, okay? Not enough to account for UV penetration through the skin. Obviously, if I'm under a covering or awning, or if I'm wearing sunscreen, because sunscreen blocks UV penetration, which is why it protects you from getting burned, okay? So you can't wear sunscreen and then go out there and get UV penetration. So if I, though, not doing any of those things, I'm skin exposed, no sunscreen, I go out there, I spend some time in the sun, I'm going to get UV penetration. And we've done a little bit of a video on calcium hormones before, and we've discussed vitamin D. But the little thing we've said in the past is SLIC, and that simply stands for skin, liver, kidney. So the first step is basically UV sunlight penetrates the skin. What does that give us? That gives us vitamin D3. So we produce vitamin D3, okay, from the UV exposure, okay, to the skin. And as you know, we're going to talk about this in a little bit. This is the most common form of vitamin D supplementation, vitamin D3. But that is not quote unquote vitamin D. We all call it vitamin D, but that is not the active form of vitamin D, okay? That is what we could call a precursor to vitamin D. So what is our body going to do? Our body is going to take this vitamin D we just produced, this vitamin D3 from the skin, and it's going to go to the liver, that's what the L stands for, where it's going to be converted to calcitriol. Okay, so we'll draw some arrows here. The liver is going to convert vitamin D3 into calcitriol, okay, which again is not quite the active form of vitamin D yet. That calcitriol is then going to be converted one more time in the kidneys to what we know as the active form of vitamin D. So that is true vitamin D. Now, can you take vitamin D3 as a supplement? Will it work? Absolutely, because you're going to take the vitamin D3, and of course, like we just said, it's going to go to the liver, be converted to calcitriol, go to the kidney, be converted to the active form of vitamin D. Okay, so we can do that. Now, when would that be a problem? Because you say, hey, I don't go out in the sun enough. I spend a lot of time outside. I do get some good sun exposure, but I'm not consistent with it myself. Yesterday I was out in the sun quite a bit. Day before I wasn't. One Monday I wasn't either. I don't get consistent sun exposure. And so for me, I need to get my vitamin D another way. Of course, there are foods that contain vitamin D, but most people don't get enough vitamin D. If they're not in the sun, every day getting good UV exposure, they're not going to get enough vitamin D. So what do I do and what many do, of course, they take vitamin D3. So when would that be a problem though? Well, the only time that would be a problem would be if you had liver disease or kidney disease. You might have trouble with the conversion. Most people are not going to have trouble with that, okay? So keep that in mind. So what do we call this vitamin D? It is called calcitriol. Okay, that is the active form of vitamin D. Now, you know this if you've watched our other video on calcium hormones. This is a hormone. So your body is, yes, manufacturing vitamin D from UV, sunlight, and really it is more accurate to call it a hormone, and that is just what it is. So the question is, with all this big spiel, is it essential? Well, the truth is vitamin D is inessential if you're getting UV sunlight penetrating your skin every day. It's inessential. You're going to manufacture it, assuming, there's no issues with skin, liver, or kidney, okay? But for many people that aren't getting UV exposure every day, okay, then it's probably an essential nutrient, meaning you're going to have to take it some other way. Get it from the diet because it is very important hormone. So let's talk about what it does real fast. Calcitriol, the main function of calcitriol, of course, is to let you absorb calcium in the small intestine. I hear a lot of people say, oh, you're drinking your milk, you're getting your dairy because you need your calcium. Well, number one, dairy's never been a great source of calcium. Do we get some calcium from dairy? Yes, but it's a long story in explaining how we get calcium from dairy. It's a very long story, and let's just put it this way. Calcium's a mineral. We get minerals from the ground. The best source of calcium is going to be green leafy vegetables. Let's just put it at that, okay? Leave it there. Now, let's say though you're getting plenty of calcium in the diet. You've got to have the vitamin D in order to absorb it. So you can be taking all the calcium in the world, and you're going to have issues with calcium absorption if you're not taking in the vitamin D. So that's why vitamin D is so crucial. It's why the average American honestly gets enough calcium. Average American eating the average American diet, they really get enough calcium. What do they not get? They don't get enough vitamin D. That's where many of the issues lie. So that person says, I'm drinking milk every day because I want my calcium. Well, they've got to realize if you're not taking in vitamin D, or of course, like we said, getting it from the sunlight, you're not really getting your calcium. Okay, and that's why osteoporosis is still super, super common. We see it in women, of course, more commonly. We see it in men as well. As estrogen levels drop in women who are postmenopausal, that increases osteoclast activity, and that makes osteoporosis even worse. It's more bone robbing to a woman. So osteoporosis is a big, big issue. Now, what are some of the other things we know about vitamin D in addition to calcium absorption? One of the other things we know about vitamin D now from many, many studies from Harvard, many, many other universities, has shown that vitamin D decreases, or vitamin D deficiency, is indirectly linked to higher cancer rates. Or put another way, higher levels of vitamin D or normal levels of vitamin D in a person can be up to a 50% reduction in some cancers. What are those cancers? Well, some happen to be prostate, breast, colon cancer. So it's really, really important to have adequate levels of vitamin D. And that's why I'm a big believer in vitamin D. So that's my little spiel for today in our clinical anatomy series on vitamin D. As always, before you go out and do anything or recommend anything to anyone, you should consult your doctor or physician. And as always, look for more videos. Good luck and good study.